Welcome to Beyond Extraordinary, brought to you by LCMC Health. We are an 8-hospital system providing health, care, and education to the greater New Orleans area. Our academic medical center status, with 2 academic medical centers, means we have our finger on the pulse of the latest treatments and technologies in medicine, and we're bringing it right to our community. Hi, I'm Dr. Tony Flowers. I'm Corporate Chief Opportunity and Social Responsibility Officer here at LCMC Health. June is Men's Health Month, and today we're joined by CJ Marbley, who holds many roles here at LCMC Health. Hi, CJ. Why don't you tell us about all the roles that you hold and how you came to LCMC Health?
Good morning, Tony. Thanks for having me here. So I hold several roles, several dual roles here at LCMC Health. I started off at Manny Family Children's Hospital in 2017. From there, I became the Chief Nursing Officer at New Orleans East Hospital. Did that for 3 years, and then in April of 2020, our COO there went back home to California, and so I absorbed that role as COO at New Orleans East Hospital also. So since April 2020, I've been the Chief Nursing Officer and Chief Operating Officer at New Orleans East Hospital, which was one of the 8 hospitals in LCMC Health. And then in 2023, in October 2023, I came over to University Medical Center and took on the role as Vice President of Nursing Operations.
Well, that's a lot, and we're so glad that you are here
you.
and fulfilling all those roles masterfully. Tell me, why is Men's Health Month so important, and why should we celebrate?
Men's health is so important to our community, to our families, and we really try to educate men on how to take better care of themselves. We've seen with the statistics where if you look at the Movember Foundation, men die 5 years earlier than women by history. And most of those illnesses that they are presented with are preventable or manageable if they get early care. So we want to encourage men to seek out health care early and often and really think about how they can better be there longer and better for their families.
CJ, why do you think men might be more hesitant to seek health care?
I think it's a couple of different things and many different reasons. I think we haven't grown up in a situation where we seek medical care regularly. If you look at teenage girls and teenage boys, where you're in high school, you're getting physicals for school and things of that nature. But after high school, many young men, they don't see a reason to seek health care anymore. Women, they tend to get their annual exams with GYN and things of that nature. But men, we really don't have anything that kind of forces us to go between those ages of 18 and 40 to go to the doctor every year for a checkup. So I think we get separated from the healthcare system, and it's the macho, I'm good, I'm strong, I'm fine. My friends and I in healthcare, we often say fine and good are 4-letter words because that's what you hear from men a lot of times. How are you doing? I'm fine. How are you doing? I'm good. And we have to, as men, with each other, stop accepting fine and good as an acceptable answer. Really ask the second, third question about how they're really doing.
Wow, that's really interesting, especially not recognizing the age difference and how there's nothing that's driving men to healthcare. How can we help men to be more proactive about seeking healthcare?
I think we have to give men a sense of what it means to them, like what it means to be healthy at an older age, what it means to avoid some of these pitfalls in health that we have. And you see in Louisiana, heart disease and cancer are the number one killers of men. And those things are manageable, preventable sometimes, very treatable if caught early. But we have a lot of men with heart disease, stroke, cancer diagnosis, especially colon cancer, prostate cancer also. Those are screening, we have screening tools that really can catch those. I often tell men, treat your body like you treat your car.
Oh, wow. Okay.
So we're real diligent about getting our oil changed every 5,000 miles. We're real diligent about getting our tires rotated. you have to treat your body the same way. So get your oil change. Go to the doctor, get your oil change, get your tires rotated. Yeah, get your lab work done, get an annual exam. I had a couple of friends recently, and they're in their late 50s, early 60s, and they had to go through all these tests and things of that nature. And I said, you got to look at it like your 90,000-mile checkup for your car when they just come in and do all those different
Make it
things.
relatable.
Make it relatable for them. And, every other time that you get your oil change, you should be doing something for your health. How do you make it real for men? How do you make it, because their body is more valuable than whatever car they have,
You're right.
no matter how expensive it is. And really, it's really about living long enough to pass on your legacy, right? So we have men, dying early and not being able to pass on their legacy. And, being a grandfather of 5, a father of 5, grandfather of 5, what I've learned is we pass on our assets to our kids, but we pass on our legacy to our grandkids. And you have to be healthy enough and strong enough to live long enough to pass on that legacy to your kids, because they soak up your grandkids, because they soak up everything you say.
That is so profound. Thank you for sharing that. CJ, we talked a little bit about men not having something that drives them to do regular checkups. What are some annual screenings and checkups that men should know about?
Yeah, so the thing is, if they go to their primary care annual checkup, they'll connect them to the annual screenings. So whether it's prostate screening, if you're over 40 years old, you need to have a prostate screening. Colon cancer screening, you need to have a colonoscopy. If you're over 45 years old, you need to be able to do that, get connected to that. Testicular cancer screening, you need to be able to get checked for that also. And that's the same thing, same age range, 40 to 45. Those are all areas of cancer that if you catch them early, they're very treatable. But you got to catch them early. You can't wait. And sometimes men get scared, and they get concerned, and they're like, "Well, I don't need that. I'm fine. I'm good." And Reggie went into the hospital, and and it never came out. Like, but Reggie hadn't gone to the doctor in 40 years. You can't drive your car for 5 years and never get it checked out. It will fall apart on you. If you drive your body like that, it will fall apart on you. So men have to know that it is their responsibility. The good thing is that, many of us have women in our lives who push us to go.
Kicking and screaming sometimes, right?
But whatever resource it is, whether it's your kids, your spouse, your significant other, whoever, if I encourage them also to force the man in your life to go and get screenings.
Excellent. So we've talked about physical health. Let's talk about mental health in men.
And that's really where the fine and good come in. Because you have men going through struggles. It's a lot coming at people these days. And how do we create a safe space for men to have those conversations, to be vulnerable? We've done a lot of things with barbershops and things of that nature. We've held symposiums with churches and things of that nature. But it's trying to find that safe space where men can speak about their mental health and their emotions. Because sometimes it shows up different with men. It doesn't show up some kind of sad and depressed. Sometimes it shows up angry, withdrawn. Sometimes it shows up where they're, taking care of themselves even less. So it's really trying to figure out, how do you get men in a place where they can say, hey, I'm feeling really upset or anxious about this going on in my life, or I'm feeling really concerned, I'm lashing out to my family or whatever. How do we get them in a space where they can be vulnerable and say those things and not judge them? And that's what men, a lot of times, they don't want to be judged. They don't feel like they're weak. They don't feel like they're vulnerable. They don't feel like they're, not a man. So how do we create the space where it's safe for them to say that?
That's really, really interesting to recognize that as strong as we see men, they are also protecting themselves and not necessarily feeling comfortable to be vulnerable. So creating a safe space where men can feel vulnerable. CJ, it seems that this issue is more prevalent in minority populations. Can you talk a little bit about that?
Yes, so we see it in populations where there economic depression, where there are health disparities and things of that nature. And really, if you look at it, you can see zip code by zip code how their surroundings and their zip code and their environment really affects their health.
Yeah,
We live
those
in
social determinants of health.
the social determinants of health. So we live in New Orleans where we have two neighborhoods that are 4 miles apart when there's a 25-year life expectancy gap. In the neighborhood with the lower life expectancy gap, that's a neighborhood where you see a lot of those social determinants of health kick in. And so it's how do you take health care to them? How do you invite them into health care and make it comfortable for them? You know, fortunately, we have at LCMC Health, we have hospitals that are in neighborhoods that are connected to neighborhoods that are historically the hospital for the whole city. You know, so you have UMC, who took the place of Charity, who is the hospital for the city and the state. Everybody knows that they can seek care there. We have Children's Hospital that, you know, no matter where kids are around the state, they can come there and seek care. We have all these other community hospitals where they're so connected to the community they're in. And that's a way to really connect people, even no matter what neighborhoods they're in, no matter what social determinant health they're in, we can reach out to them and connect them to care right there in their neighborhoods.
Yeah, we're creating those cultures of wellness. You've given us some great tips and things to consider where men's health is concerned. And speaking of culture of wellness, that's something we're working hard to create here at LCMC Health. And so we ask all of our guests, what do you do to create wellness for yourself?
I do two things really. So people often ask me, it's like, how do you manage all those different roles in two different hospitals?
Right.
And it really is about how I start my day and how I end my day. So I start my day every morning with a workout session at 5 a.m. And it is a group of leaders and staff from LCMC Health from multiple different hospitals. We all get together at 5 o'clock in the morning and we work out and we push ourselves and laugh and joke and really have a great time. And then at the end of the day, my wife and I often go out dancing. We're in New Orleans, so we take advantage of all the different spots that you can go and listen to live music, dance. So we love to do that. So I always try to start my day and finish my day with movement. And then during the middle of my day, I really lean on my spiritual foundation.
Thank you so much for sharing.
Absolutely.
Thank you for joining us, CJ, and thank you for listening. Join us as we go beyond extraordinary every fourth Tuesday of the month.